Hi guys, today we will be discussing categorization of risk to the research subject in clinical research. So, this categorization of risk to the research subject forms the basis for the type of review recommended by the institutional ethics committee. And evaluation of the possible risk to the research subject and also the associated benefits is the most challenging task before the institutional ethics committee. So, what are the types of risk involved? There are four types. One is less than minimal risk, then low risk, and high risk. High risk is also called as more than minimal risk. So, first coming to the less than minimal risk. So, in this, the probability of harm or discomfort in the research is nil or not expected. Probability of harm or discomfort to the subjects is either nil or not expected. So what are the example? So the examples are research on anonymous or non-identified data. Or the samples, or the research on data already available in the public domain. So this is about less than minimal risk, where the probability of the harm or discomfort is either nil or non-expected. And what are the examples? It is the example research on anonymous or non-identifiable data or samples and data available in the public domain. Now coming to the minimal risk. In the minimal risk, the probability of the harm or discomfort in this case, it is not greater than that encountered in the routine daily life activities. Not greater than that encountered in the routine daily life activities. So this, what are the routine daily life activities of a average healthy individuals? And what is the example of this? It is the research involving routine questioning or history taking, or history taking, or physical examination, or doing a chest x-ray, or obtaining body fluids, so like saliva, urine. And this obtaining of the body fluids should be without invasive intervention. Now coming to the low risk. Here there is increment in the probability of harm or discomfort which is little more than that of the minimal risk threshold. So what are the examples of this? It is routine research on children or adolescent, research on person incapable of giving consent, incapable of giving consent, delaying or withholding a proven intervention in a control or a placebo control during RCTs, delaying or withholding a proven intervention in control or placebo group in RCTs. Also use of minimally invasive procedures. And these procedures, they might cause mild or no more than brief pain, or tenderness, small bruises or scars, or drawing a sample of blood for testing. Also trying a new diagnostic technique in pregnant and breastfeeding women comes under this criteria. Feeding or pregnant women. Social risk, psychological harm and discomfort. So all these things, they go under low risk, like routine research on children and adolescents, those person who are incapable of giving consent, delaying or withholding a proven intervention in control or placebo control group, use of minimally invasive procedures, trying a new diagnostic technique in breastfeeding or pregnant women, social risk, psychological harm or discomfort. And now comes the fourth category, that is high risk. High risk, or it is also known as more than minimal risk. In this, the examples are any interventional study using a drug or device. Interventional study using a drug or device. Invasive procedures such as lumbar puncture, lung or liver biopsy. Puncture lung or liver biopsy. This comes under invasive procedure. Other example is endoscopic procedure. So this is all about the risk involved to the research subjects in the research criteria. So what it forms? It forms the basic of the type of review recommended by the Institutional Ethics Committee. The risks are of 4 types: less than minimal risk, low risk, high risk. Now in the less than minimal risk, the probability of the harm or discomfort is nil or not expected. Examples of this are research on the anonymous subjects, non-identified data or samples, and data available in the public domain. Under the minimal risk comes in which the probability of the harm or discomfort is not greater than that encountered in the routine daily life activities of average healthy individuals. So what is the example of this? Routine questioning or history taking, physical examination of the patient, chest x-ray, obtaining body fluid that is without any invasive intervention like obtaining of saliva or obtaining of urine. Coming to the low risk, the probability of the harm is little more than the minimal risk threshold. So what are the example? Routine research on the children or adolescents, those who are incapable of giving consent, delaying or withholding a proven intervention in control or placebo group in a RCT, use of minimally invasive procedures which have mild or no more than a brief pain, tenderness, small bruises or scars, drawing of the blood samples for testing, trying a new diagnostic technique for the breastfeeding or pregnant women, and those clinical research which are involving social risk, psychological harm and discomfort. Now coming to the 4th criteria, that is high risk or more than minimal risk. Under this goes the example of any interventional study using a drug or device, invasive procedures like the lumbar puncture, lung or liver biopsy, and endoscopic procedures. So basing on this, there will be a type of review by the ethics committee. So the type of review will be discussed in the next lecture, which are expedited review, exempted review, and full committee review. So these things will be discussed in my next lecture.